My name is Daniel Craig, Cancer Outreach Coordinator at Tammy Walker Cancer Center. I appreciate the opportunity to present at today's Lunch and Learn on the benefits of quitting smoking and free programs available to help. Some of the topics we're going to cover today include the health risks of smoking, what makes it so difficult to quit, the benefits of quitting smoking, keys to preparing to quit, e-cigarettes and other tobacco products, smoking cessation medications, and free support groups and programs that provide coaching to help quit and stay quit. Smoking is a leading cause of preventable death in the United States, causing an estimated 480,000 deaths each year. Cigarette smoking harms nearly every organ of the body, causes many diseases, and reduces the health of smokers in general. In 1964, the first Surgeon General's report on smoking and health was published. It established smoking as a cause of lung cancer. The chart on this slide highlights some of the cancers and chronic diseases caused by smoking. The items in bold were new findings in the 2014 Surgeon General's report, which means that 50 years after that initial report, we are still learning about more health effects caused by smoking. From national data, we know that approximately 70% of smokers want to quit, and around 50% make a quit attempt each year. However, without medications and counseling, there's a greater than 95% relapse rate. The two main things that make it difficult to quit are that your brain has to get used to not having nicotine around, and you have to get used to daily routines that no longer include smoking. When you smoke a cigarette, it activates reward pathways in your brain and causes pleasant feelings and distracts from unpleasant feelings. Then, when you can't use cigarettes, you may feel irritated or upset, jumpy or restless, have a hard time concentrating, or feel anxious or depressed. The fastest way to get a drug to the brain is by smoking it. Nicotine is inhaled from cigarette smoke and travels directly to the lungs, where it is immediately absorbed into the bloodstream. Once in the blood, nicotine travels to the heart, where it is then pumped throughout the entire body, including the brain. This fast delivery is one reason smoking cigarettes is so addicting. A typical smoker will take approximately 10 puffs on a cigarette over the roughly 5 minutes that the cigarette is lit. This means that a person who smokes 1 pack of cigarettes daily gets 200 hits of nicotine to the brain each day. And so that is a physical addiction to nicotine. The second thing that makes it hard to quit smoking is the behavioral aspect of dependence. When you smoke cigarettes, your days are filled with routines that you associate with smoking, and many people associate smoking with things like drinking a cup of coffee, finishing a meal, talking with friends, or using the phone. So in order to quit smoking, you have to deal with both the physiological components of addiction and also address behavioral aspects of dependence, including breaking those associations between smoking and common activities. Now I want to cover a few things that can be helpful in quitting and staying quit. The first step is to get ready by setting a quit date, ideally within the next 30 days. Prior to your quit date, change your environment by getting rid of anything that might trigger you to want to smoke. It is also important to review your past attempts to quit. Regardless of whether you quit for 2 days or 2 years, there were things that helped you quit, and there were things that caused you to start smoking again. The things that helped you quit in the past may be helpful again, and you need to develop a plan to address those things that caused you to start smoking again in the past. It is also important to get support and encouragement. Some great sources of support include talking to your family, friends, and coworkers, visiting with a healthcare provider, and enrolling in individual, group, or telephone counseling. Smoking has played a role in your life, so it is important to find new things to help reduce stress, like exercising, reading a book, listening to music, or anything else that you enjoy. FDA approved medications can help by reducing withdrawal symptoms. If you are anxious, irritable, or upset, it will be harder to address behavioral components of addiction. There are 5 FDA approved medications that contain nicotine, which are commonly referred to as nicotine replacement therapy. They are the nicotine patch, the nicotine gum, the nicotine lozenge, the nicotine inhaler, and the nicotine nasal spray. Bupropion, also known as Zyban or Wellbutrin, is an atypical antidepressant that has an independent effect on helping people stop smoking. Varenicline, also known by the brand name Chantix, may aid smoking cessation in two ways. As a partial agonist, it binds to and produces partial stimulation of nicotinic receptors, thereby reducing the symptoms of nicotine withdrawal. As an antagonist, it blocks the nicotine and tobacco smoke from binding to the receptor, thereby reducing the rewarding effects of tobacco. Smoking cessation medications are safe and effective for most individuals. However, individuals who are pregnant or trying to become pregnant, under the age of 18, or who have a medical condition should talk to their doctor before taking medications. Most relapses occur within the first 3 months of quitting. Don't be discouraged if you start smoking again. Most people try several times before they finally quit. Stress and weight gain are two of the most common reasons people report for why they started smoking again. Visit with your healthcare provider if you are having problems with either of these. Smokeless tobacco has been marketed in the past as a safer alternative to smoking. However, we know that smokeless tobacco has cancer-causing chemicals, including tobacco-specific nitrosamines, as well as harmful metals such as arsenic and lead. Smokeless tobacco often has a very high level of nicotine. 1 can of snuff can have as much nicotine as up to 4 packs of cigarettes. Smokeless tobacco can cause cancer of the mouth, esophagus, and pancreas, and may increase the risk of heart disease and stroke. I get a lot of questions about electronic cigarettes. They're still fairly new, and there's a lot that we don't know about the long-term health effects of using electronic cigarettes. What we do know is that electronic cigarettes are not safe for youth and young adults, individuals who are pregnant, as well as adults who are not currently using tobacco products. Studies are showing that there are a lot of adults who are using electronic cigarettes in an attempt to quit smoking. However, unfortunately, many adults do not quit smoking and instead become a dual user. And it is important to note that electronic cigarettes are not currently approved by the FDA as a quit smoking aid. The aerosol from electronic cigarettes can contain ultrafine particles, cancer-causing chemicals, and heavy metals such as nickel, tin, and lead. And while it can be difficult to quit, the good news is we know that treatment works. Counseling, which can include telephone quit lines, individual or group programs, can more than double success rates in quitting. And a combination of counseling and medications is the most effective treatment. In terms of monotherapy, Chantix is the only FDA-approved medication that is significantly more effective than the other medications. But more and more providers are doing combination therapy, typically starting with a slow-acting nicotine replacement therapy like the nicotine patch, and adding a fast-acting nicotine replacement therapy like the nicotine gum or the nicotine lozenge. And the research is showing that this is a very effective approach. And the good news is that most insurers will cover FDA-approved medication. One potential exception could be if a plan is grandfathered. So it's always best to check with your health insurance provider to see what your coverage is. I want to highlight the expanded benefits in CanCare. CanCare now covers up to 4 rounds of treatment with the FDA-approved medications. So for those of you working with patients, if they have CanCare, they have really great coverage. However, what we find is that many people are not aware of the coverage they have. For individuals without health insurance, there is a Pfizer Prescription Pathways Pharmacy Assistance Program, which covers Chantix, the nicotine inhaler, and the nicotine nasal spray. There are some requirements to qualify, including income guidelines. The FDA-approved medications are great for helping with withdrawal symptoms. If you are anxious, irritable, tense, nervous, and upset, it will be difficult to work on the behavioral aspects of dependence. Now we're going to look at some of the free counseling programs which help address the behavioral aspects of dependence. The first is a Kansas Tobacco Quit Line. All states have toll-free quit line. The Kansas Tobacco Quit Line provides free coaching to help develop an individualized plan to quit. The Kansas Tobacco Quit Line has a couple of specialized programs, including the Quit Line Behavioral Health Program, which is a great resource for individuals living with substance abuse disorder or mental illness. The Quitline Behavioral Health Program provides additional coaching calls, as well as 4 weeks of free nicotine replacement therapy, a choice of the patch, the gum, or lozenge. The Quitline Pregnancy Program offers 5 coaching sessions during pregnancy and 4 sessions postpartum with the same female coach. And the My Life, My Quit program is designed to help Kansas teens ages 13 to 17 quit tobacco and nicotine, including the use of vaping products. Another really great resource is a free tobacco cessation classes offered through our partnership with the Masonic Cancer Alliance. The course consists of 8 one-hour sessions offered via Zoom on Mondays at noon or Tuesdays at 5:30 p.m. The course is very interactive and uses materials from the Mayo Clinic Nicotine Dependence Center. And starting on February 1st, participants who are employees at Salina Regional Health Center will receive 200 wellness points. You'll need to attend at least 8 sessions. If you miss a session, you can just make it up at the end of the program by attending an additional session. When you register, just put that you were referred by Salina Regional Health Center, and that will let them know to send verification of completion of the course so that you can get your wellness points. And with that, here are my references. And I'd be glad to answer any questions that you have. And here's my contact information. And you're welcome to reach out to me anytime, call me or email me with any questions, or if there's anything I can do to help.